Good morning, everyone. We are all welcome to another section of health tips. And we're considering the topic peptic ulcer disease. What is a peptic ulcer? It is an excavation that is formed in the mucosal wall of the stomach, the pylorus, the duodenum, or the oesophagus. It is frequently referred to as gastric, that is, it occurs in the stomach, the duodenal, that is, it occurs in the duodenum, or oesophageal ulcer, which occurs in the oesophagus, depending on its location. It is caused by an erosion, which is a break of a circumscribed area of mucous membrane. Oesophageal ulcer results from the backward flow of hydrochloric acid from the stomach into the esophagus. So we have the incidence now. The greatest frequency is noted in people between ages 40 and 60 years, and it occurs commonly in males. It may be acute or chronic. Acute means that it occurs for a short period of time, heals completely or promptly, or it occurs for a very long period of time, which is also known as the chronic peptic ulcer. What are the causes of peptic ulcer disease? The major cause of peptic ulcer disease is a bacterial infection, which is known as a Helicobacter Pylori. So what are the predisposing factors of peptic ulcer disease? Bile reflux, that is, bile and pancreatic juices tends to damage the gastric. Then we have a family history of peptic ulcer. If your father, if your mother, your sister, or your daughter, or your son, anyone has peptic ulcer disease, then you could also have peptic ulcer disease. Then we also know that blood type O predisposes to peptic ulcer disease. Then the male gender, I have said it before, that it occurs commonly in males than in females. Then chronic use of nonsteroidal anti-inflammatory drugs, such as diclofenac, such as Ibufrofen. If you use them chronically, it could predispose you to peptic ulcer disease. Then we have alcohol ingestion. Alcohol such as spirits, such as dry gin, such as beers. If you take them in excess, it could predispose one to peptic ulcer disease. Then we have carbonated drinks such as Coke, Sprite, 7-Up, etc. Then stress ulcer due to trauma or serious illness such as infection, which is also known as sepsis, burns, etc., can predispose one to peptic ulcer disease. Excessive smoking. Then we have possibly high stress. The stress could be emotional or psychogenic. So what are the clinical manifestations, also known as the signs and symptoms of peptic ulcer disease? We have a dull running pain, that is a burning sensation in the mid-epigastrum, or that is radiating to the back. Pain is, however, relieved by heating or taking alkaline. And how is the alkaline? What do we mean by alkaline? Anything that neutralizes an acid. And how the alkaline wears off, or the stomach empties, the pain returns. Then we have heartburn in the esophagus and the stomach, which moves to the mouth with a sore eructation, that is bulbing. When you bulb, that means that there is a sore, you produce a sore eructation there. Then we have occasional nausea and vomiting, and we also have weight loss. So those are the signs and symptoms of peptic ulcer disease. So what are the management of peptic ulcer disease? The first management is to eradicate Helicobacter pylori, or you should manage the gastric acidity within the mucosal lining of the stomach. So the pharmacologic therapy is mainly 4 to 8 weeks duration of treatment. So antibiotics to eradicate this infection, which is the Helicobacter pylori, is to be taken within 2 weeks. And what are the antibiotics that could be taken? We have metronidazole 400 mg 3 times daily, that is in the morning, afternoon, and at night. Then we have amoxicillin 500 mg 3 times daily, morning, afternoon, and night. Then we have omeprazole, or you could use rabeprazole, or you could use esomeprazole. They are also in the same class of antibiotics, and we have 40 milligram. And these antibiotics in general, metronidazole, amoxicillin, omeprazole, it could be rabeprazole, it could be esomeprazole. They are within the same class of it's not an antibiotic now. It is a proton pump inhibitor. I shouldn't bother you with that. And what is the essence of this? It is to decrease the stomach acid secretion. Then we also have antacids. Antacids such as gastric, such as gestid, mismag, magnesium hydroxide, aluminum hydroxide, whatever, anyone you have. This antacid is to neutralizes the gastric acid. So antacids such as, for example, gastric, you could take that 10 mils. You will have a cap that is calibrated. So you should take that either 10 to 15 mils in the morning, in the afternoon, and at night. And all these in general, all these drugs in general, you should adhere strictly to prescribed medication. It is very, very important. Lifestyle changes or modifications now. We have stress reduction and rest, which are the priority interventions. The individual needs to identify situations that are stressful or exhausting and implement changes immediately. Then we have smoking cessation is strongly encouraged because smoking raises duodenal or gastric acidity and significantly inhibits ulcer repair or healing. Then dietary modifications. Individuals should eat whatever agrees with them. You shouldn't change your diet, but you should have them in a small but frequent manner. Then you should be advised to eat 3 to 4 regular meals per day. Then alcohol and caffeinated beverages such as coffee, cola, caffeine should be avoided as it irritates the gastric mucosa. Then you should be taught that follow-up visit is necessary. Ulcer could recur. Then you should be advised to seek medical help if symptoms recur. Then avoid gas-forming and spicy foods as much as possible. Gas-forming foods like meats, like beans should be avoided. Then avoid drugs like aspirin, diclofenac, Ibufrofen, etc. Complications may be absent if properly treated. But if not properly treated, what are the complications that can occur? We have hemorrhage, which is upper GI bleeding. We have perforation of the gastrointestinal system, that is the stomach and the duodenum. Then we have penetration too. Then we could also have obstruction, that is a gastric outlet obstruction around the stomach. So how will you differentiate if you have duodenal or gastric ulcer? Pain accompanying duodenal ulcer is referred to the back, and it occurs usually between meals. When you feel that you are hungry, then I think that one is a form of duodenal ulcer, not a gastric ulcer. Then for gastric ulcer, pain is relieved by food, and it occurs 60 to 90 minutes after meals. Thank you for listening. God bless you.